So here is some really good news to do with treatment of Parvo. And this is, Elanco is the name of the company who makes a monoclonal antibody that can be used to treat dogs that have Parvo. This is something that they announced back in May of this year. So this is really fresh stuff. I suspect that a lot of your vets won't know about this if you run into a situation where you want to try and use this. But anyway, let's talk for a second about Parvo. So Parvo is very contagious. It is typically given to other dogs through feces or through people who've handled infected dogs. So the places that you're typically going to get this would be other infected dogs infect your dogs, going to the vet where the vets handle a dog that's had Parvo, parks and places where lots of dogs frequent. Those are likely places to get Parvo. If a dog has not been vaccinated, it's very contagious. There's a very good chance the dog will get Parvo. 90% of dogs that contract Parvo die from it. That's not to say that there aren't treatments for it, because there are, and I've got videos on that. So you can dramatically reduce the chance of death by, well, let's talk about what the problem gets to be. The problem gets to be that a dog that has Parvo, the Parvo virus really affects the gastrointestinal tract and it also affects bone marrow. And what happens is typically it gets damage to the intestinal walls, it causes blood in the stool, it causes violent diarrhea, it causes vomiting, and a dog then dies because it's not getting any nutrition, it's losing all its electrolytes, it's vomiting and losing electrolytes, and then maybe gets septicemia because its intestinal tract gets infected. Bad, bad day. Dogs that have got Parvo and you don't know about it will become infectious to other dogs about 3 days after they have contracted it, and they will continue to do that for about 7 days. Dogs that are treated for Parvo, well, dogs that aren't treated for Parvo, they look awful, they've got no appetite, they've got liquid stool out their back end, they're vomiting, they're just sitting there with their head down, drooling. Those dogs that aren't treated get in trouble very quickly, and probably within 10 days they're dead. Dogs that are treated successfully, at 80% of them can survive, and the treatment for it is just to give intravenous fluids, anti-vomiting medication, and antibiotics for secondary infections. And if you can get a dog that's showing signs of Parvo past about 5 days, normally you're out of the woods and the dog will be okay. And you've got to be very, very careful about not infecting other dogs. If you go to the vet, it's going to cost you $1,000 to fix the dog, to get the dog better, if it even works. So that's the problem. Parvo is bad news. And the Parvo virus, once you've got it on your property, it can stay there for up to a year, and it's difficult to get rid of. So this is why it's very important that we get rid of poop, and that we are routinely on a daily basis using antiseptics to clean up our places where our puppies and dogs are. And the dogs that are susceptible to this, of course, are the dogs that don't have full immunity, so puppies up to the age of 6 months, and dogs that haven't been vaccinated. Okay, so here comes along Elanco and comes up with a monoclonal antibody product that could be given to dogs that have Parvo. So before this, there is no treatment to get rid of the Parvo virus other than vaccinating to stopping it ever becoming a problem, which of course we all need to continue doing. The problem is that once your dog has got Parvo, you've just got to treat the symptoms and you can't get rid of the Parvo itself. It has to run its course. But now not. Now, so the first thing is this is on a temporary state-by-state license to use this product, has to be administered by a vet. I have no idea what the cost of it is, but it's going to be a lot less expensive than having a vet look after your dog for days, with presumably a better outcome. I don't know what the outcomes are, but apparently it works pretty well. It's not going to fix all problems. The product has to be kept at 5 degrees Fahrenheit or minus 15 degrees centigrade, so it has to be kept in, not liquid nitrogen, but dry ice. You've got to have a place that's set up for this. You're not going to get this over the counter. You're not going to go buy this from Chewy. You've got to go to a vet, and then you've got to be in an approved state to even get started on this. So I don't know, and I've never used this yet. I haven't had to, thank God. But I mean, if I did, I'd be looking at where I can go to a vet to get this done. It has to be given intravenously. So that means that the dog is going to be in the office for an hour or two while they give an intravenous IV line set up and put the drugs in. It's a one-dose product, so you don't have to keep going back. And I can tell you, if I had a dog that had Parvo, I'd be looking this up right away because it's a horrible, horrible, horrible death for dogs. And the outcome's not very good. Even when you treat it, it's not perfect. Okay, so where can you get it? You've got to go to a vet in an approved state. I'm sure this will become widely available as we know more about it, but for right now it's limited. When can you use it? So 8 weeks or older, not before 8 weeks, and we'll talk about that here in a moment. How is it administered? By an IV. It's actually kept in a vial at minus 15 degrees centigrade, 5 degrees Fahrenheit, and then it's given as an IV. Complications. Well, we don't have enough information to really discuss this in any length that I found, but the one complication is apparently it can affect future ability to vaccinate a dog because the dog has got a certain amount of antibodies present that can interfere with the response to a future vaccination. So let's just talk about that because that's kind of relevant here, I think. So what's going on here is if you look at time versus percentage of effectiveness against Parvo. What's going on is so this is 100%. This means great protection. This is 0%, means that the dog has got no protection. So what happens is when puppies are born, they get antibodies from their mother and they're up here. They've got immunity. That immunity they get from mum drops off as time goes on. And I mean, I'm talking about 12 weeks here. At 12 weeks, the immunity they got from mum has wore off just about completely. The puppies develop their own immunity, and so their immunity, and along with vaccinations, increases. This is the danger zone. Right in here, this is the danger zone where they don't have much immunity. You can't give a vaccination here because you've got, well, you can start giving vaccinations around at about 6 weeks. But so let's just kind of getting a little bit messy on my diagram. I want something to wipe off with. Hold on 1 second. Let me get a napkin here. Okay, so let's just make this a little bit clearer. And I mean, we're going to get rid of this time thing. I don't want to call that time. So we're going to say that this is, 4 weeks, 6 weeks, 8 weeks. Yeah, it's approximate. So you've got this zone in here that really, this is the place that a dog that's not been vaccinated, that's a puppy, is really susceptible. Because antibodies it got from mother have worn off, and the antibodies it's getting from injections are starting to build up. Remember that when you give vaccinations to dogs, they have not got full immunity until they've had a course of vaccinations, typically 3. And so they may not get full immunity against Parvo until they are, maybe, 4 months old. That's why you want to be very careful about puppies not going to places like PetSmart, puppy parks. Be careful at the vet's office, because if they are exposed to Parvo, even if they've had an injection or 2, they could still run into getting Parvo. So for those dogs that end up getting Parvo, along comes Elanco to the rescue, hopefully. Monoclonal antibodies. So hopefully their monoclonal antibodies protect those dogs, or dogs that are out here because you have not done your job and you didn't vaccinate your dog in the first place. Some dogs can get Parvo because there's some inherited problem with their autoimmune system. They're sick, they've got cancer, they've got other things that have suppressed their immune system. They're taking drugs to suppress their immune system. Those can affect older dogs that are, year 2, 3, 4 years old. Again, we've got potentially a treatment for this. So this is pretty exciting news, because Parvo is really tough stuff. I've had it twice in 30 years, and the first time I had it, I didn't know what the hell I was doing, and the whole litter died. The second time I had it, I was much more successful, and I lost 1 puppy. That was it. So it was not anywhere near as stressful. In both those cases, I took care of it myself. But yeah, so how does this work? I don't think I can explain this very well because I'm not a microbiologist. But basically, they produce a a virus antibody that is made up from two different components, apparently a dog component and a rat component. And then they then purify that, and that's what you put in the dog. And I think it's probably put in as a dead product, not live. And what happens is you've got these nasty little Parvo viruses swimming around in the dog, and these antibodies that we produce tie to this thing and basically isolate it so it can't go in and start messing up cells in the dog's body. So this kind of sequesters it. Right, not a very good explanation. But the important thing is, Elanco, you'll know more about this as time goes on. If your vet says, I don't know what you're talking about, Google it, and then you can then say, hey, look, I've got a sick dog, maybe we can try this product. So there we go. Good luck with that. I hope that helps some people who are in for a miserable time if they don't find a fix for Parvo. Remember, clean up your areas, avoid contact with other dogs you don't know about, limit access to puppies to other areas and other dogs until they are fully vaccinated, and get your dogs vaccinated. So that's the first thing. You don't want to run into having to use this. You want to fix it before it ever becomes a problem. But if it becomes a problem, then maybe Elanco is the fix for you. Thanks for watching. Bye. Encourage me to do more of these videos. But do remember, disclaimer here, I am not a vet. I'm not a licensed medical professional. I'm purely a person who's been breeding dogs for the last couple of decades. Any information that you got from this video, use at your own risk. There's nothing implied here, and certainly this should not be used as a substitute for advice from your veterinarian or your medical professional. I hope you enjoyed the video. Come back for more of them. Frisky now, come on up here, Joel.